Hi everyone, welcome to Living a Balanced Life with Julio. On today's episode, we're going to answer some questions about the video I made, posted 2 weeks ago about blood pressure and its management. There was a couple of questions. I got a lot of phone calls and a lot of text messages about what about stress and blood pressure? What about caffeine and blood pressure? So in today's episode, we're going to talk about those two, caffeine and stress, and how it affects our blood pressure and things that we can use to control that to in a way manage our blood pressure. So if you're interested, please stay with me. As we learned in our first video, blood pressure is the force or the pressure against the vessels as your blood circulate around, right? So our blood pressure is influenced by a lot of things. The way, if we have stress, it influences our blood pressure. If we drink or eat certain things, it increases our blood pressure, and certain lifestyle also causes an increase in our blood pressure. So today we're going to talk about some tips and to answer some of the questions that people were asking me about caffeine. So to start with caffeine is a stimulant. So that means when it goes in your body, it causes your blood pressure to increase. And there's a lot of theories about how it does that. There's a theory about coffee causing adrenaline in your blood, the hormone in your blood to go higher, and in doing that, narrowing the arteries and the vessels, and that will cause the blood pressure to go up. So there's a lot of theories, but the bottom line is we know that caffeine can cause a temporary increase in blood pressure. So there's a lot of caffeine that's hidden in certain foods that we don't even know have caffeine in it. So of course coffee has caffeine, espresso, green tea, black tea, all of that has caffeine in it. Dark chocolate has caffeine in it. So and then some sodas, right? Like some Coca-Colas and all those things have caffeine in it. And energy drinks. Most energy drinks have caffeine in it, and that's what keeps you awake and all energized, right? So it stimulates the body. So in doing that, it can cause high blood pressure for some people, and usually it's temporary. So when it's put away, the blood pressure returns back to normal. Some people, having said that, are very sensitive to caffeine. So with those people, if you have high blood pressure or you want to find ways to manage your blood pressure, eliminating caffeine beverages and caffeine food that contain caffeine can be one way to do that. So making sure that if you want to know if you're sensitive to coffee or caffeinated food, then have your blood pressure, have your coffee, or for whatever contain, like if you drink green tea, black tea, all of that, drink it. Half an hour to about 120 minutes later, check your blood pressure and see if it increased. If your blood pressure increased about 10 points from the original blood pressure, then that you can say that you're sensitive caffeine. So in that sense, if you have high blood pressure and you're managing it, one way to do that is to eliminate the coffee, right? So I know some people who like to have your coffee, and that's fine. Just make sure that you do decaffeinated coffee. It tastes the same as coffee, but it doesn't have the caffeine that's going to cause your blood pressure to increase in it. So that's one way of making sure that your blood pressure doesn't go higher if you're someone with hypertension, or if you want to control your body from getting hypertension. This is one way of doing that. Another question that I got was stress. How does stress affect blood pressure? So as we know, stress comes and goes. Stress comes in many forms. When we're ill, our body reacts as if that's under stress, right? So whenever we're ill, that's stress on our body. Whenever we have family stress, emotional stress, any kind of stress that we have, our body reacts to it. And in reacting to it is what can lead to the issues of, for example, causing high blood pressure. So stress, a little bit of stress is not harmful to the body, but if it becomes chronic, meaning you're always under stress, under constant stress, that can cause your blood pressure to go up, because whenever we're stressed, our body releases hormones that cause our heart rate to increase. It causes our blood vessels to narrow and therefore make our pressure goes high, right? But remember, when you remove that stimulant or remove the stress, the blood pressure can return to normal, and then you can be able to manage your blood pressure. But if you're under constant stress, then that means that your body is your vessels are constantly narrowed, and your heart rate is always racing, and that's not good for you over a long run. Some other things that can cause our body to have to react negatively to stress is if we have, for example, anxiety, if we're diagnosed with anxiety, or have depression, or if we are some people that think negative, right? All those things can cause our body to react to stress and release hormones that can be harmful to our body, right? Because, for example, when we think negative, what we think is what we are. It's this the power of the mind. Our mind is very powerful. So if we're constantly thinking about negative things, you can see that it will start to manifest, because it's almost like that's what you're looking for. So it's a good practice to look at the positive side of things and look at solutions to stresses that you're going through. Not saying that you're not going to have stress that comes and go. We all have it, but looking at it with a different lens is a good way to help you de-stress. Another way of de-stressing is, of course, if you're exercising, right? Whenever we're exercising, our body is producing hormones that help manage stress. So anti-stress hormones are released when we're exercising. So this is why I always talk about exercise. Movement is very important. You exercise at least, for it to count, at least 10 minutes. If you're getting 10 minutes exercise, doing it twice a day, or if you're doing 20 minutes exercise 7 days a week, or if you're doing 30 minutes exercise 5 days a week, as long as you're meeting the minimum recommendation of 150 minutes per week, that will help you control stress. Because when you're exercising, your body's releasing hormone. These hormones are helping you de-stress. So it therefore helps lower your blood pressure, right? So that's another way. Another way of making sure that we are de-stressing is, breathing exercises. Sometimes we don't think it's effective, but it really actually calms the mind and helps you relax. And whenever you're relaxed, your vessels are also relaxed, right? So then when your vessels are relaxed, the pressure in your arteries are lower, on your vessels are lower, and therefore help lower your blood pressure. So relaxing exercises, breathing exercises are good ways to make sure that we're de-stressing, so we can improve our blood pressure, right? There's lots of, if you go on YouTube, there's so many relaxing breathing exercise and relaxing exercise and music that can help calm the mind. All those are good for stress management. So if you haven't tried that, try some of that and see if that's one way that can help you. Usually when people are going to bed, at that time you can, to calm down and calm your mind to be able to sleep, you can listen to relaxing music and some of these breathing exercises to help you de-stress so you can fall asleep. And that brings me to my next topic, sleep. Whenever we're not sleeping, our body is under stress. When we're not sleeping, our body thinks we are stressed, and when our body thinks we're stressed, it releases hormones to deal with the stress, and those stress hormones cause our pressure to go high. It can make us gain weight for some people, so it has a lot of negative effect on our body. So making sure that you're getting sleep is very important, and quality sleep. So it's recommended to get 7 to 9 hours of sleep if you're an adult, and if you have children, between 9 to 11 hours of sleep is a recommendation. If you are sleeping and you're still waking up very tired, you're getting enough sleep, but you're still waking up very tired, I can't stress this enough. It's very important to talk to your healthcare provider, because there could be an underlying problem. And when you have underlying problem that's affecting you, not affecting your sleep, no matter what you do, even if you take medication, you won't be able to sleep properly. So it's important that you find out what the underlying problem is. It could be sleep apnea, meaning sleep apnea is a condition where when you're sleeping, it's like your tongue almost falls back to your throat and you're not getting enough oxygen to the brain and to the body. And when you're doing that, even though you're sleeping, you're not getting the oxygen and the restful sleep that you need. So your body is under stress, right? So doing that, it can lead to a lot of complications. It can lead to heart disease, it can lead to diabetes, and it can lead to other chronic illnesses. So if you are someone that sleeps but always feels so tired, your doctor can send you to go to get a sleep test done, and then they can monitor you to see how you're sleeping, how much hours you're getting, and if you're getting restful sleep, meaning you're getting enough oxygen to your body, to all the vital organs while you're sleeping. And this is one way of improving your sleep. Sometimes some people, they have to get them the masks to sleep with, to help them open their throat so they can get the oxygen that they need to the vital organs, so they can sleep better and improve their health. So these are some of the tips about management. I hope I've answered your question about stress. Stress is something that affects us in so many ways, and people that are under constant stress, it can lead to a lot of chronic diseases like diabetes, like heart disease, like hypertension, what we're talking about. So making sure that you're de-stressing doesn't mean stress doesn't happen. It does, it happens, but it's how you manage it that improves your health. So, you know, if it's talking to someone to help you calm down, so you can talk to social workers, psychologists, all of that to help you, that's fine. For some people that suffer from anxiety and depression, sometimes when you see your doctor, they can prescribe certain medication for you that will help you with anxiety and depression, because when you are under that, those constant stress from those conditions, it affects our body negatively anyway. So one way of making sure that we are taking care of ourselves is seeking help and getting the help that we need to manage our stress, manage our life, and prevent complications from stress. Caffeine, all of that can lead to high blood pressure, strokes, heart attacks, and other chronic illnesses. So until next time, I hope you're going to try some of these tips, include some of these healthy tips into your daily routine. If you drink coffee and you find out that you're sensitive, eliminate caffeine foods and use decaf foods to help you. If you're someone that's under a lot of stress, speak to your healthcare providers. They have social workers, they have counselors that can help you. Depends on what the stress is, to manage that, so that way you can move on, learn some skills that can help you to improve your health, prevent complication, and prevent chronic diseases. So if you have not subscribed to my YouTube channel, please do so. Hit the red subscribe button, check and then hit the bell, so every time I release a video, you'll be able to get it right away, and then you'll be able to learn something to help you improve your life. Share with your friends so they can also work to improve their lives, so we can all work to achieve the balance that we need in our life. So until next time, take care and stay healthy. Bye.
Exclusive